Hello, my name is Dr. Garrett Carrica and I'm here from Amigo Animal Clinic. And what we wanted to do today was kind of give you an inside look of what our hospital is, where everything is, and kind of what your furry friend sees when they kind of take the direction around the hospital. So let's start. So this is where everyone enters from. So if you've been here before, this is our main lobby. This is where our reception team works with you to answer any questions you have, any phone calls, and usually, hopefully, greets you with a smiling face. From that point, we try our best to get you into our exam rooms as quickly as possible because we know that you have more going on in this world than just coming to see us. So one of our many exam rooms look just like this, where we have an area where you can sit down. We have kind of we call it state-of-the-art exam tables that can come down, so that way if you have a little furry friend, they can come up on the table. If you have a big furry friend, then we'll just move these out of the way and we have this whole room to kind of do our exam. In the event that maybe we need to do a little bit more than just kind of do a physical exam, say we need to take blood work, kind of more other things, we usually take them out of the room, and sometimes you guys will have to stay here. So we'll kind of show you where they go. So follow me. As we move down this hallway, there's more exam rooms similar to the one we saw. In the case that maybe your furry friend was sick and it was contagious, we have 2 rooms here that you might come into, and these are our isolation rooms, so that way they don't get any other furry friends sick, because no one wants to be sick, especially with times like now. This area right here, this is our pharmacy, so all of our drugs that we might be sending you home with are locked away in these cabinets and then are accessed at the time that they're needed. The area right here is where we do kind of all of our microscopes, our cytology. Anytime we say we want to poke a mass or we want to look at maybe the blood, we'll kind of look at it here with our own eyes after it's been run through a machine that we'll show you real shortly. One of the things that's really important for the care of all furry creatures, and even including ourselves, is dental care. So right here is we have an awesome setup where we can run 2 dentals at the same time. There's computers, we have radiographs that we take, there's warmers, we have full anesthesia with monitoring for all of our patients when they're under, and this is kind of where they hang out during that time. Say for instance, so we said we wanted to pull blood or we need to get some urine. Usually they come to our treatment area. This is kind of the busiest area of our clinic. This is usually where there's anywhere from 3, 4, 5 technicians kind of working around with a doctor or 2. And this is where any blood would be pulled if we needed to get urine, if we need to do another exam. Sometimes we'll kind of go into this room over here. And in this room, this is where we can do ultrasound. So sometimes we'll look at your animal, but we can't just quite figure out what's going on from just our physical. So we can use an ultrasound machine in this quiet room to kind of image non-invasively what's going on under the skin. And another way to kind of see what's going on in the body, especially the organs, is to run blood. And so when we do run blood, we'll pull it in this room, but then in here we'll have one of our many technicians who will run the blood, and we can get results as soon as 15 minutes from pulling the blood, which is pretty remarkable. Sometimes we need to see imaging like x-rays or radiographs, and so this is where we would take radiographs. And so in this room we have digital radiographs, so we can take radiographs, and as soon as we take them, they're up on this computer screen so we can see exactly what we're looking at, what we need. I don't know if any of you are a little bit older. In the old days, you would take radiographs and then you do go into a dark room, have to expose them and finish them. And now with digital, we get our information within seconds, and so it's really, really awesome. Let's see. And then every once in a while, or if they, for instance, needed a spay or neuter, we do surgery. And in those cases, all of our patients are prepared in our treatment area, And then once they are ready to go into surgery, that means they are hooked up, we've intubated them, they have monitoring, they are rolled in. And in this room is where we do all of our surgery. So this is things like as routine as spay and neuters, all the way up to neurology, doing back surgery with Dr. McGuire, and everything in between. So if your dog had a rock in its stomach and it went to surgery, it would end up on one of these tables at some point. And all of these machines are used to keep them under. We have monitoring equipment, we have lights, we have all of our equipment that's sterilized over here. And even in the corner here is where all the sterilization gets done. So there's two, what they're called autoclaves, which make everything completely sterilized. And then those packs are put into this window that then are transferred to our surgery area. So that way your furry friend has the lowest chance of getting any kind of infection from surgery. So, and then the last thing that maybe we can talk about is kind of on our way out, because once they've had all their treatments and kind of where are we in our hospital, sometimes they'll walk through. We have all of our doctors that work in here. Our employees have their break room. And as you come around the corner here, we're right back to where we all started on this tour with our main waiting room, where hopefully you're able to go on your way with either great results or a great experience. And so hopefully we get to see you soon. And if you have any questions, let us know.